Whenever a person comes for a rhinoplasty consultation, the first thing I ask is, what bothers you the most about your nose? You want to make it clear in your mind and have a clear understanding from the patient about the number one thing that they would like to change about their nose. Normally, there are a few things that people want to change. I make sure, especially for rhinoplasty, but in every consultation, to listen to what kind of change each patient would like. When it comes to respecting your cultural background and what it means for the shape of your nose, I want the result to be so that when a stranger walks by, the first thing they would see is not your nose. They would rather see your eyes first. I think the nose, when it's at the center of the very middle of your face, it should kind of blend in the overall facial aesthetic. Oftentimes this is overlooked, is that the nose has to breathe as well or better than how it looks. When a person wants a rhinoplasty, oftentimes a patient wants a smaller nose. Now, I have to make sure that even though I make the patient's nose smaller, that it still breathes well, that it's not too congested or too narrow of the breathing passages. I always tell patients that we can achieve, let's say, a bump on the nose or a bulbous round tip. When it comes to changing that, I say, yes, we can do that. I have to respect your breathing, and your nose may be a little bit wider, especially in the immediate recovery period. When I do the operation, I always have to make sure that this is going to be a nose that breathes well for the rest of your life.